take the second presenter. Let's take the second presentation by Miss Elizabeth Orgi. Miss Elizabeth Orgi is a certified dental therapist who co-owns and runs a family dental clinic at Jalingo, Taraba State.
Hi, good morning, everyone. Thank you for being present here. And also, I thank the opportunity given to me to go ahead to present this paper using the algorithmic pattern of the artificial intelligence to reconcile dental caries and lifestyle. So when we go over to the second slide, talk about the abstract, the introduction, the methodology, challenges faced or possibly that will be faced, conclusions, and then references. When we go over to the abstract, we understand that artificial intelligence simply refers to the idea of machines being able to perform tasks assigned to them, just as human beings do. So what is algorithmic pattern? Just a subdomain of artificial intelligence. And you can also call it or look alike, or you can call it machine learning. So it has the ability to detect patterns, statistical patterns, deep statistical patterns being given to it, and it can cast predictions even on data that you as a person cannot see. So when you feed information to human beings, we as human beings can come up with conclusions. But when you feed information to an artificial intelligence and run an algorithmic pattern through it, there is some information and some data that you and I cannot see that this machine can pick up. So that's what algorithmic pattern basically do. So now we want to see how can we reconcile dental caries, lifestyle, using algorithmic patterns. So these two denominators is what we want to run through this artificial intelligence network. So lifestyle, just like I said, to me is the major cause of dental caries. So we want to know to what level can lifestyle affect dental caries. I can say this probably from my own professional knowledge, but in a deeper way, can I actually say it is true? So for me to actually go deeper, it's being able to use algorithmic patterns to be able to know the little things that I might have missed in trying to judge dental caries and lifestyle, or reconciling either of them. So we go to the next slide, which is the introduction. Algorithmic patterns, which are uncomplicated tools, computations, formulas, statistical surveys, and tables used in determined care. So algorithmic patterns can be repeated in a particular process. So you can run it, then you can run it again, and you can run it again. You just keep running it. So lifestyle, like I've said, is a particular way or in which individual or a group of people has chosen to live their life. So it can boil about their behavioral orientation, about their attitudes, about their habits, their moral standards, and the values in which they uphold. So what about poor lifestyle? We know what lifestyle is in general. Poor lifestyle, excuse me, I think I missed my slide. Okay. Poor lifestyle, it plays a key role in terms of our diet. The diet we eat every day, especially we as Nigerians, it's the major fact or the major cause why we have dental caries in our mouth. Like you can know about our culture in the north, where we eat a lot of monosodium glutamate in our foods. We eat a lot of sugar in our foods. And these are culprits that aids in escalating dental caries. They make food sweet where we don't, when you have monosodium glutamate in your house and you want to cook with it, you don't have to bother about adding other ingredients that have nutrients in your food. Probably because you are poor, probably because you are more comfortable eating that way. So not knowing that monosodium glutamate is actually one of the leading causes of dental caries. So we want to know, when we look into poor lifestyle, can this poor lifestyle actually be a cause of dental caries? Over to the next slide. Continuation of introduction. Another factor we are looking at in poor lifestyle is smoking. Smoking, I used to think that smoking was an average thing until I understand that smoking also involves using of shisha, smoking also involves using of snuff, smoking also involves using of the cigar, the weed, and all other cocaine things that we know. And for me to know about 80% of us actually indulge in one or two of these habits when I did my research was actually shocking. And why I really look at smoking is the fact that smoking actually numbs pain. People who smoke a lot don't feel pain easily compared to people who don't smoke at all. So when they are down with a little bit of hole in their teeth, or they have dental caries, you and I can actually feel the pain quite early and do something about it. But for a smoker, he doesn't know that he has that hole. Because of the effect of smoking in the body, the pain manifests much later. And most times when they realize that they have hole on their teeth, or they have dental caries, it has actually gone way beyond saving. So we have to see smoking also as a predecessor, or as a culprit in determining lifestyle in relation to dental caries. Another thing we are looking at is lack of regular toothbrushing. A lot of us don't brush regularly, and those who brush don't even brush effectively. So we are going to look at this as a factor. We know people from the wealthy class, as in people who are exposed to TV, people who are exposed to the knowledge, have better technique in brushing and brush regularly compared to those who live in rural area. There are some people who live in rural area who don't even brush at all. So we're going to look at regular toothbrushing. So we might be brushing, but brushing regularly, it's what we are looking at to be one of the lifestyle issues we're going to talk about in terms of reconciling it to dental caries. So what we are looking at is just the algorithmic patterns of this thing. So we are dubbing it from artificial intelligence to see how we can reconcile that with dental caries, so that we'll know which of these factors stand out the most in determining that. So over to the next slide. Talk about the methodology. So there are two types of machine learning or algorithmic pattern that can be developed, which is the supervised and the unsupervised learning. Supervised learning is you feed data into this system, then you sit down and you keep observing them. While the unsupervised learning is that you feed this data into the system and then you walk away, you come back and see your results. So we are looking at the unsupervised way of learning, of machine learning, to get our findings or collecting of data that we use to reconcile dental caries and lifestyle. So one way in which we can be able to get our data is through patient folder. The patient folder, it's this folder we use. This data we collect from patients, we write them down. So when we write them down, because I believe most of us write down before we input into the computer. So when we write them down, or we type them into the system. So when we type them into the system, they will become a digital file. We write them down in paper, we just normally call them patient folder. So we'll write them into this digital file. So this digital file can be fed into a dental software called Curve Dental. Curve Dental is an artificial intelligence program, artificial intelligence machine. It's an artificial intelligence software. So it's a software which, when you feed data into it, it can give you results using the key interface style of detecting of patterns. So AI uses algorithmic patterns to collect data. So this data that is collected from Curve Dental can be analyzed. So over to the next slide. So what are the patterns that we want to feed into Curve Dental? We can feed dental caries and high sugar intake. So when we go into Curve Dental software, we'll say the software should look into dental caries and high sugar intake, which is one of what we've talked about. Also look into dental caries and smoking. We look into dental caries and lack of regular toothbrushing. So these are the keyword interface I'm talking about. We type them into the system, and then we allow the machine to run algorithmic patterns on this and bring out findings. Another way in which method we can apply in getting our data is called deep learning. So deep learning is most common in imaging, so like in your X-ray and all other kind of diagnostic imaging styles we use. So this technique can be applied when an AI machine is attached to diagnostic imaging. It goes deeper into finding out results or detecting patterns that we cannot see basically on the surface. So that's that. So in respect to lifestyle, how can we use diagnostic deep learning in lifestyle? We can use deep learning in lifestyle in detecting medical dental history, socio-demographic and clinical data, also imagery data too, biomolecular data, social network data. So this multi-level data helps in reconciling lifestyle. We have to know if the person is rich, if the person is poor. We have to know how often the person brushes his or her teeth. We want to know the person's medical history, person's dental history. So this data is what deep learning actually extracts from the system. So the only way this can be very effective is if we can get patients that can actually give you the right information. If they give you the right information, it's best to get out this information from using deep learning technique to search for relationships or reconcile data between dental caries and lifestyle. Over to the next slide. Fuzzy logic. Fuzzy logic is, sometimes when you clerk a patient, he gives you information that you can't fully articulate or you can't fully understand, or you're trying to help the patient, but the information are not really reconciling, or they are not complete, or they are not correct. So this is where fuzzy logic comes in. Fuzzy logic is a template, or will I say is a software developed by a scientist called Loftizadeh. So those information, when you feed them into the system, the fuzzy logic system uses 4 ways to actually defalsify the information. The first is the rule bars. The rule bars are the rules set out to do what? To harness those data that are not correct, or those data that are irreconcilable. Then it goes through what's called falsification. So the falsification is the machine trying to do what? To pick out deeper, more information out of that. So inference engine tries to reconcile those data, and the falsification is bringing out the result of what has been analyzed. So the goal of fuzzy logic is just to mimic human reasoning ability. So when a patient gives you this information, you are trying to make sense out of it. That's what fuzzy logic systems actually do. It tries to mimic the human kind of reasoning to bring out results from information that might be incorrect or irreconcilable. So different experts actually use fuzzy logic system a lot. Over to the next slide. We talk about challenges in using artificial intelligence. Although artificial intelligence is a good system, but we face some challenges, which is complexity of the mechanism. The mechanism is very complicated. Also, the cost involved in setting it up is very expensive. Enormous data is required, so you actually have to look for a lot of data to be able to use this system effectively to actually achieve accuracy. Adequate training is required. It needs a lot of training, and also the outcome of artificial intelligence or these results that we get are not really applicable immediately compared to doing it manually. So what is my conclusion? In conclusion, artificial intelligence is not what we just watch in the movies and see how they use a lot of machines in especially movies we watch, modern day movies. But it's actually something that we can start now and work on it for the future. So how can we really help as professionals is to actually collect accurate data from our patients. When we collect accurate data from our patients, when in the future, when future dental professionals want to run our data that we collect in the past into the system, they can easily reconcile this data more effectively when the data are accurate. So we don't have to miss any step when we collect data for our patients. Also, it's the use of algorithm is something we do every day in our lives, and it's something that when we look into it in terms of getting clinical findings, such as just I've mentioned dental caries and lifestyle, we can actually use it in treating our patients. So even at that, we know that the concept is bulky and all that, but we know that it's something that can be used in the future. Maybe you and I might not be able to use artificial intelligence effectively now, but we can be able to prepare the bedding ground for our future colleagues that will be coming up after us. So one thing I know is that we as professionals have to look away from the way we are doing things and look into knowing that artificial intelligence has come to stay. We can't take it away. It's the future, and we should look at ways where we as professionals can incorporate artificial intelligence into our professional activities. Over to the references, and that is all. Thank you so much for listening. I enjoy talking to each of you all. Thank you.